Hello, I'm Jordan with Active Healing Center, and today we're going to be talking about osteoporosis, how to build stronger bones. And I'm going to be going over some of the basic information about osteoporosis versus osteopenia, some causes of osteoporosis, and the action steps that you can take to improve your bone density, whether you already have osteoporosis or if you're trying to prevent it. We'll talk about some of the nutritional things that you can do, and I really want to focus in, as a physical therapist, I really want to focus in on the exercises that you can do, the physical things that you can do, because loading muscles and loading bones increases the body's response to then grow more bone, which thereby increases the density. So let's just jump right into some of the terminology around osteoporosis, and then we'll lead into some things that you can do to focus your efforts on increasing your bone density. And again, I'm going to focus in on not so much on medications or more of the medical side of things, but as a PT, on the physical things that you can do, because that's really my expertise. That's where I've spent 20 years helping people with this, and that's what I want to give back to the community, so that to be as helpful as possible. So osteoporosis is the technical version of osteoporosis is that it's a decrease in the it's an imbalance in how much bone our little cells are laying down. It's a decrease in how much bone is being laid down versus how much is being absorbed. We have osteoblasts, which blast down bone onto our bones, and osteoclasts, which take those away. It's a metabolic change. There is a genetic predisposition to it. So if you have family members that have osteoporosis, that's one of the causes of that. And we'll get more into the causes in a minute. But basically, that the structure of your bone is a lot more, the analogy I use is it's a lot more like Swiss cheese. So someone with osteoporosis, the holes in their Swiss cheese are really big. There's less bone microarchitecture, less density of the actual structure of the cheese, and bigger holes. Someone with no osteoporosis has smaller holes. There's more cheese in their bones, if you will. So that's the best way to look at it. Sometimes people will come into the office wondering and worrying about having osteopenia. Osteopenia is a sign of, and it's sometimes you can see it on an X-ray. You can definitely see it on a DEXA scan, which is the gold standard for testing. By the way, Medicare pays for the bone scans, the bone density scans. They're called a DEXA scan, and I believe it's every 24 months currently. So get that checked out. That is on the action plan, is get that checked out. I'm jumping ahead of myself. But typically people will have some kind of an X-ray, and it shows that there might be a little bit of decrease in bone density. And then if they get the DEXA scan, it can either show osteopenia, which is signs of maybe diminished density of the bone, but not the full-on larger Swiss cheese holes, not a failure of the microarchitecture of their bone. And so that will be seen on those tests. The main causes of osteoporosis, aging is one. That just, we naturally decrease our bone density as we age. Hormonal changes, so postmenopausal women are one of the primary groups that get osteoporosis. It's a lot more common in women than men. And that decline in estrogen level is one of the things. So the hormones affect that, the laying down from the osteoblasts versus the absorption from the osteoclasts within our body. Nutritional deficiencies, so calcium and vitamin D are the two big ones, and so we want to try to optimize those. Lifestyle factors, basically just not moving, not weight bearing through the body, not walking a whole lot, not doing any kind of resistive exercise or activity. That sedentary lifestyle that's so easy to get into is a risk factor. Genetics, we talked about that. Medical conditions, so parathyroid issues, some certain digestive issues, GI issues, are all affecting the bone density. And again, I'm not going to get into the medical side of things too much, but those are some ideas. Some medications like steroids will decrease bone density. Glucocorticoids and certain anticonvulsants may also contribute to some of the bone loss. Smoking and excessive alcohol. I don't know exactly what excessive alcohol is, but that's something to talk to your doctor about. But smoking definitely decreases bone density. So what can we do? So treatments. I'm just going to whip through some of these medical things. So the medications, and this is changing, and they're really looking at this. But there are certain types of, and you'd have to talk to your doctor about this, but certain types of medications, these are hard to pronounce. Bisphosphates. I think it's biphosphates. Denosumab. So obviously this is not an area of my expertise. I'm not licensed as a physical therapist to really discuss medications, so these guys are outside of my realm, but your doctor will definitely know about them. Denosumab and hormone therapy. So there's side effects to these, and I have done some research on it. It sounds like some of them you can only use for a certain amount of time. Some of them are only effective in one type of medication for about 10 years, and then you kind of have to switch over to the other type of medication. But they work really well. So, so thank golly that there's those medications for that. But that's a little bit beyond this particular discussion. Nutrition. So we hit on that a little bit. Calcium and vitamin D. So we want to have those leafy greens, dairy, and even fortified foods with calcium and vitamin D are good. Vitamin D is getting out in the sun. That's a big one. And then also, again, fortified foods. Vitamin D can a lot of times be in milk and things like that. And then supplements as necessary. There are certain calcium recommendations. So for men 51 to 70, 1,000 milligrams a day. Women age 51 to 70, 1,200 milligrams a day. And then anybody 71 and over, it's 1,200 milligrams per day. And so let's jump into the exercise component. And that's really what I wanted to talk to you mostly about. When you're starting to think about exercise, it's really hard to give you specific advice because everybody's starting in a different place. So when you're listening about these exercises, really take into account where you are, your age, your injury status, your history, your athletic ability, your knowledge about exercises, your current stress level and time levels and time availabilities. And so I'm going to give you some exercises. They're going to be in appropriate categories to build and protect against the problems of osteoporosis, which, since we haven't mentioned yet, is primarily fractures. That's one of the big things. If your Swiss cheese holes are big and you whack your bone, or you fall, you twist, then you're more susceptible for fractures. So I'm going to show you physical movements, and I'm going to show you some gradations of that, some easy, some medium, some hard, maybe not exactly in that way, but you'll get a sense, oh, that one was a little easier, oh, that one's a little harder. My advice is really start on the easy side. In fact, I wrote a whole blog post on how to start exercising if you haven't been doing it for a long time. And one of the big principles in that is start easy and then stay easy for a while so your body has a chance to accommodate to it. And then, and only then, after you've done that activity level for a while, at least a week or two, then go up in intensity and then stay at that level for a while to let your body accommodate to it. And when we say that word accommodate, what we're really talking about with osteoporosis is give your body enough time to actually lay down some bone. And by the way, with exercise programs, they've really shown that it takes about 6 months to increase on the scans, the amount of density in bone. So give it some time. And part of that giving it time is start easy and then stay easy, accommodate to it, then bump up. So as you look at these movements that I do, if they look too hard, they probably are. So modify them or skip them or do something else. And the thing I always say, like, it's hard to do exercises correctly. It really is. And so I am going to suggest having a physical therapist look at you, do a consult, do a series of 3 sessions or something to get a sense of where you are, have them help you determine what is appropriate for you, and then watch you do it so that you know how to do it just correctly. You don't want to get hurt. So, but let's jump into some of these movements. There's several different categories of exercise that really help with osteoporosis. So one is resistance training. So that's weight bearing things, resistance things. We're talking about weights, we're talking about body weight exercises, and you want to do it of the arms. So that the areas that get fractured with osteoporosis are the wrist, the hip, the spine. Those are kind of the big ones. So we want to do arm resistance training and leg resistance training. The next group of exercises that we want to do are posture enhancing exercises. So if my posture goes here, what happens is we compress the front side of our vertebra, and that's where people can get compression fractures. So we want to have posture enhancing exercises, and I'll show you at least one thing for that. Then the third category is balance, and that is sort of balance enhancing movements. And so there are 2 parts to a balance enhancement. In a lot of the balancing talks that I've done around in the community, we talk about both having not just the balance reactions, although that is one of the things. We want to be able to respond quick, feel our feet. They call it proprioception, being able to feel, oh, I'm losing my balance, and then to be able to respond and react really quick. So balance reactions, that's one. But then the other one is actually having enough strength to catch yourself, strength to bring yourself back to center. So right now I have a weird foot injury. Even physical therapists aren't beyond having some injuries. So I noticed the other day when I was putting up, it's Christmas time, was putting up some decorations, and I was on uneven surface. My balance is actually really good, but because my foot is weak, I noticed as I went over that, oh, I had to take that little extra step to catch my balance. And it wasn't because I was losing my balance, it was because my foot wasn't strong enough to push me back up. So when we think about balance, we want to do those 2 parts, the reactions and the strengthening. And then there's just overall exercises. So, walking and yoga and Pilates or dancing, jogging, overall activities are really good for osteoporosis as well, just to stimulate our physiology. Some of those are weight bearing, and we'll talk a little bit more about that too. But things like cycling, things like swimming don't actually help with osteoporosis because they're weight free. And so they've actually shown that cyclists, sometimes there is an issue with people that spend all their time cycling because they're just not, they're not banging their bones. And I know it sounds harsh, and I don't want you to bang your bones, but when we walk or when we jog or when we really resist things, there's pressure on those bones, there's some banging on those bones, and that's what increases the density. So let's go over some of these exercises. I want to do first just some resistance exercises. So let's start with the arms and the legs. So the first resistance exercise that I want to do, I lied, I'm going to do the legs first. Stand up, sit downs. Man, this one exercise helps so many people. And if you watch some of my other videos, I put it on almost every one when we start talking about exercise, because everybody's got a chair. Everybody, and unless you're in a wheelchair or just experiencing a real decline in you're super sick or really experiencing a big decline in how well you're moving around, everybody can at least stand up or sit down a couple times. And so you use your arms if you need to. So you sit down and you stand up nice and square. We don't want to do the over to one side and then no, you want to go real square. So you can offset your feet. I don't know if you can see my feet or not, but I have one foot slightly in front of the other. Sometimes they're even. Use the hands. So we stand up all the way, throw the shoulders back, squeeze those glutes, very safely touch, and then back down. If you can do it without hands, great. But for safety, a lot of times, even if you're not pushing, I recommend just touching the arm of the chair, and you're really going to feel those leg muscles. So stand up, sit downs. A really great arm exercise, you won't be able to see me really well, but it's going to be like a wall push-up. We can put some weight through the arms. We can either have our elbows together, or we can move the elbows out. You never want to have any shoulder pain when you're doing this. So this needs to be just felt in the muscles here and the muscles here. And it goes something like this. Hands are on there. Wall push-ups. You can flare your elbows out a little bit, but we either want them mostly tucked in or out at maybe a 45. I wouldn't get them too far out, that way it starts to pinch. As you get stronger, you can do that on a countertop. I don't have a countertop height, but we'll just use the chair here, and we can just start small. Small little push-up. Small little push-up. Just getting that weight through the arms. So we talked about, I mean, those are some basic ones. Another great balance and strengthening is going to be a single leg, side leg lift. So we can hold on to something and we go out. Notice how I'm not leaning to the side. That's no good. We don't want to do that. We just want to go spine nice and straight. Do that as many times as you can. As you get stronger with better balance, no hands or just a little bit of pressure. You're working both this leg that's standing, holding the stance, and you're also working that leg. Start with however many you can, and then flip around and do the other side. So we've got stand-up, sit-downs for the legs. We've got some wall push-ups, progressing to countertop push-ups, progressing down to like a chair push-up or a bed push-up. And then we've got our standing leg lift. You can do those leg motions front to back. Sometimes a balance exercise is actually swinging back and forth with the leg. Obviously that's more advanced, but a very good strengthening exercise is just that simple side leg lift without moving the spine. The core stays engaged. That's basically a solid resistance exercise. We did some arms, we did some legs. Then there's some postural stabilization exercises that we can do. And there's 1,000 different things. We can pull on bands, we can do, you could do things in the weight room. But it's a very simple one is getting up against a wall. I'm going to call this a wall here. You lean your butt against the wall, your bum against the wall, walk your feet out a little bit. Your knees are engaged. Knees are bent so that your quads are engaged. Pull your tummy muscles in so you're engaging your core. Shoulders are back. And you're going to get into a don't shoot me position. Now, if you've got shoulder issues, just keep the arms down here. Sometimes people even just have their hands in their lap. The main thing is to pull the belly button in so your back goes flat, and roll your shoulders back together. But if we put the hands up here, which is a slightly more intense position, it just is a little bit more challenging. When the hands go here, make sure your back doesn't arch up off the wall. You want to keep using your core to press your low back into the wall. You'll feel, as you raise your arms up and down a little different challenge between the shoulder blades. You want to avoid shrugging the shoulders and drop the shoulders down. My fingers are moving towards the wall. They're not necessarily going to touch, but that's the direction they're going. My core is engaged, my shoulders are back, they're staying down, my hands are in this W position, and I hold that for 30 seconds. Then I rest, and we do that 3 to 5 repetitions. If this is too much, again, just have your hands down there. You don't want to have any neck pain. You don't want to have any shoulder pain. You should be feeling this mostly right between the shoulder blades. So that's a good solid posture exercise. There's lots of other things that you could do, but if that's all you did, that would be just fine. Balancing exercises. There's lots of different ways to do balancing exercises, but just a simple tightrope position. So usually I have people hold on. So imagine that there's like a kitchen sink in front of me. Hold on to that. I guess I could show you here. So hold on to something. One foot's in front of the other. Bend the knees a little bit, engage the core, shoulders are back, eyes are on the horizon, and then balance there. You know, can I balance there? All right, 20 seconds or so. Then switch feet. Now my other foot is forward. Balance, 20 seconds, and then repeat. Go through that 2 or 3 times each foot orientation. If that's too hard, then you can, instead of having your feet perfectly in a row, you can offset them a little bit. If that's still too hard, sometimes we'll put the feet together. If that's still too hard, have a little bit of space. But if you're walking and not needing to use a cane or a walker, you can probably do it with your feet together. If you are needing to use your cane or walker, then spread the feet apart or try the tightrope balance with a little bit of an offset. Again, that's where you have to see what's appropriate for you at that time. But holding it for about 20 seconds and then doing at least 2 or 3 repetitions each foot position is a good balance reaction type of an exercise. You can make it harder by turning the head, doing some little head turns. You can make it harder, and I recommend, if you ever do close your eyes, I recommend you definitely hold on to something. My favorite place is the kitchen sink, because if you have some balance issues and you go backwards and you're just holding on to a shelf, you don't have anything to protect you. But I like the kitchen sink because there's that lip there, so you can put your hands right inside that lip, and even if I'm not touching, if I close my eyes and I lose my balance, boom, my hands bonk against that. The kitchen sink is a great place to do balancing exercises. So we said there's 2 types of balancing exercises. There's reaction ones, which we just did, where we're testing those reactions. And then there's strength balance exercises. Our stand-up, sit-down was a strength balancing exercise. That gives us a lot of strength. This side leg lift was a strength balancing exercise. Another strengthening exercise that's a little bit more intense, so be careful with this one, is a clock lunge. And so if you think about a clock in the olden days, we had our 12 o'clock, we have our 6 o'clock, we have our 3 o'clock or 9 o'clock. And so we can take a small lunge in each of those directions. So we could do a 12 o'clock and a 6 o'clock. We could do a side, a 3 o'clock. And then watch this one. We could do a 9 o'clock. So we can kind of get we could do a little diagonal over there. So just taking some little steps in all of these different directions can really help with catching your balance should you lose your balance in one of those directions. If you've never been there, you won't be strong there. So if we're practicing, if something's happening, I'm doing something over here and then I lose my balance, well, that's great to catch yourself, but is your body strong enough to push yourself back up? So just a basic lunge in the 4 cardinal directions, or even some of those diagonals. Maybe start with, 5 times each direction, something like that. Again, it's just going to depend on what is appropriate for you. And movements to avoid. So with osteoporosis and really anything, we don't want to be in a hunched over position, which is just so hard because all of our stuff is forward. My hands and my eyes, everything faces forward, our devices. And so that's why we did that exercise here to practice getting out of hunched forward and strengthening the muscles in between the shoulder blades. But another part of that, other than an exercise, is just having awareness. So when we catch ourselves hunching down, eating our food, driving our car, trying to remember to pull the tummy muscles in, roll the shoulders back, and start to activate some of those muscles that hopefully you start to strengthen there. Reading in bed is one that I hear a lot. A lot of people come in with neck pain that have been reading in bed, and the problem with that is that your feet are way over there, the pillows are behind you, but what happens is your bum slides forward and you end up in a rounded position. So we want to have adequate pillows to keep our spine in a neutral position. You can recline in your recliner, but just have this be a straight line, not a rounded line, because that roundedness compresses the front edge of those vertebrae. And if the bone density is low, that compression in a static hold is what creates some of those compression fractures. That's where that word comes from. That's where that term comes from. So, lifestyle modifications, we talked about not smoking, decreasing excessive alcohol use. I would say that if I had an action plan, the first thing is get a DEXA scan if you're 60 years plus, or if you've got an x-ray and they're showing that there's a decrease in density, or you're having any concern, get that DEXA scan. See if you have a little bit of decreased density. Do you have some osteopenia, or do I have full-on osteoporosis? And then if so, then you're going to talk to your doctor about medications and what you should do. But really working on either way, working on whether you are diagnosed with osteoporosis or penia, is just your diet, just having that adequate calcium, vitamin D, those leafy greens, those dairy. Definitely, obviously, exercise is a big one on there. We already talked about a bunch of different exercises and movements, but it's that weight bearing. We didn't talk about walking. Walking is one of the greatest things to do. They did an interesting study though. You have for walking to actually increase your bone density, you need to walk at 3 miles per hour, which isn't too bad. It's 20 minutes for a mile. If you walk, but you only walk 2 miles per hour, meaning you walk 30 minutes, it takes you 30 minutes to walk a mile, you can maintain your bone density in this study. But in order to actually help grow more bone, you've got to walk a little bit faster. It's pretty brisk. It's a 20-minute mile. It's 3 miles an hour. But things like dancing, and they actually sometimes will do stomping exercises. They'll do 4 stomps. And it's been shown to help with stimulating that bone growth because of that pressure and that vibration that goes through there. So that's actually I know that looks silly, but stomping 4 times, doing 2 sets, each 2 sets of 4, so 1, 2, 3, 4, 1, 2, 3, 4, and then going through that twice, they've shown that can actually decrease bone loss in the legs too. So yeah, I think we've covered it all. I hope I've made that point strongly enough. We're talking a lot of, I'm a physical therapist. This is what I see people do is not move enough or move incorrectly, and having a curated, customized for you in your phase of life movement plan to help you with osteoporosis is really, really important. I'm tempted to say, hey, go have a personal trainer look at you, and nothing against them, except that I see that there can be, not with everybody, but there can be a tendency to be overly aggressive. And the problem with athletic trainers, personal trainers, is that they're focused more on athletics and sports and performance rather than anybody that's ever had injuries. And when you have some changes in your body related to osteoporosis, sometimes there are some other changes that have been there where you're not going to tolerate the standard types of movements that personal trainers can do. So we do offer, this is not something that I'm trying to grow, but it's something that we absolutely do 100% specialize in the treatment of osteoporosis. And so we can create a customized plan for anybody who comes in, where we can see them move, see what level their body is, listen very carefully to their story, because that's really important to us, is to really treat the human in front of us so that we can understand what they need, and then create that plan so that you don't get hurt and you move forward in the way that you want to. To me, it's about 3 sessions is good. Consult and then begin the exercises, check in with the exercises, make sure everything's going well, talk about diet and things, and then progress the exercises in the 3rd session. That's a good way of thinking about it. Sometimes people need more time than that. Some people need less than that. They've already been exercising, they're very familiar with it. They just need maybe a single session too. And again, that's not why I'm making this video, but I am here, and we are here as a resource if you need that. And if there's any question, get someone to help you, whether it's us or someone else. Just careful with the real aggressive sports kind of movement people. You don't want to get hurt as number one. Thank you so much for your time. And if you have questions, our number is, I'm sure, on this video, but it's 805-934-0663. We'd love to talk to you. And if you have any questions or there's anything else we can do to help you, please give us a shout. All right. Thanks for your time.